avocados, and calcium absorption. What seniors should know. The silent crisis most seniors don't see coming. Did you know that after age 65, your body's ability to absorb calcium drops by nearly 40%? Yet, this vital mineral is what keeps your bones from becoming fragile time bombs, ready to fracture with the slightest fall. But here's what most seniors aren't told. The solution might be sitting right in your kitchen, and it's not what you'd expect. While milk and yogurt get all the attention for bone health, there's a creamy, nutrient-dense fruit that could be the missing link between calcium intake and actual calcium absorption. And unlike calcium supplements that often pass right through your system, this natural alternative works with your aging body, not against it. I'm Dr. David Walker, a senior health and psychological wellness expert with over 30 years of experience helping older adults not just add years to their lives, but add life to their years. Today, I'm sharing a discovery that's transformed how my patients approach bone health after 60, and it involves one of nature's most perfect foods, the humble avocado. The calcium paradox. Why taking more doesn't always mean absorbing more. Ever wonder why, despite religiously taking your calcium supplements, your bone density scans still show concerning results? You're not alone. Barbara, a 72-year-old patient of mine, was diligently consuming 1,200 milligrams of calcium daily through both diet and supplements. Yet her DEXA scan showed progressive bone loss year after year. "I don't understand," she told me, frustrated, tears in her eyes. "I'm doing everything right." What Barbara didn't realize, and what many seniors don't, is that calcium absorption dramatically declines with age. After 65, your intestinal capacity to absorb calcium can decrease by up to 40%. Additionally, the hormonal changes that come with aging further compromise this ability. For women post-menopause, the drop in estrogen, which facilitates calcium absorption, creates a perfect storm for bone health challenges. But here's where the story takes an interesting turn. Recent research has shown that specific nutrients can significantly enhance calcium absorption, even in aging bodies. And one particular food contains a remarkable combination of these helper nutrients, the avocado. Think about it this way. Taking calcium supplements without the right helpers is like having a key to a door but not enough strength to turn it. The key, calcium, is there, but without proper assistance, it can't perform its function. Avocados provide that assistance in multiple, scientifically proven ways. Next time you're at the grocery store, don't just walk past the produce section. Consider adding some avocados to your cart. They might just be the bone health allies you never knew you needed. But before I explain exactly how avocados work their magic, let's understand why traditional calcium strategies often fall short for seniors. The avocado advantage, nature's calcium absorption booster. Now, let's explore what makes avocados such powerful allies for senior bone health. The secret lies in three key components that work synergistically to enhance calcium absorption. First, avocados are an excellent source of vitamin K, providing approximately 18% of your daily requirement in just half a fruit. This often overlooked vitamin plays a crucial role in bone metabolism. Research published in medical journals has shown that vitamin K increases calcium absorption and reduces urinary calcium excretion, meaning more calcium stays in your body where it's needed. Think of vitamin K as the traffic officer directing calcium to your bones instead of allowing it to pass through your system unused. For Margaret, a 68-year-old patient who incorporated an avocado into her daily routine, this made all the difference. After 6 months, her follow-up tests showed significantly improved calcium retention compared to when she was only taking supplements. Second, avocados contain healthy monounsaturated fats that enhance the absorption of fat-soluble vitamins, including vitamin D, which is absolutely essential for calcium absorption. Many seniors focus on calcium intake, but completely overlook the crucial role of vitamin D in the equation. Without sufficient vitamin D, even the most calcium-rich diet will fail to strengthen your bones effectively. And third, avocados provide magnesium, another mineral that works hand in hand with calcium for proper bone formation. As we age, magnesium deficiency becomes increasingly common, creating another obstacle to effective calcium utilization. But here's the question that might be on your mind. How exactly should you incorporate avocados into your routine to maximize these benefits? Let's look at some practical approaches that have worked for my patients. Implementing the avocado strategy. Practical tips for seniors. If you're thinking, that's all well and good, Dr. Walker, but how do I actually use avocados to improve my calcium absorption? I've got you covered with some practical strategies. The most effective approach I've found with my patients combines avocados with calcium-rich foods in the same meal. For example, Thomas, an 81-year-old with osteopenia, started adding avocado slices to his morning yogurt, pairing the calcium-rich dairy with avocado's absorption-enhancing nutrients. Within a year, his bone density had stabilized for the first time in 5 years. Here's a simple daily plan that incorporates avocados strategically. Breakfast boost. Add 1/4 avocado to your morning smoothie, along with yogurt or fortified plant milk for a calcium absorption power combo. Lunch enhancement. Top your salad with avocado slices and include dark leafy greens like kale, which are rich in both calcium and vitamin K, creating a synergistic effect. Dinner complement. Prepare a side of guacamole to accompany calcium-rich meals like bean-based dishes or fish with edible bones, such as sardines. But a word of caution: balance is key. While avocados are incredibly nutritious, they are also calorie-dense. For seniors watching their weight, a half avocado daily is typically sufficient to gain the bone health benefits without excess calories. Patricia, a 75-year-old patient concerned about weight gain, found this balanced approach worked perfectly for her bone health goals while maintaining her weight. Have you tried incorporating avocados into your calcium strategy yet? If not, which of these approaches seems most doable for your lifestyle? Let's now look at some potential challenges you might face and how to overcome them. Beyond avocados, creating a complete calcium absorption strategy. While avocados are remarkable calcium absorption enhancers, they work best as part of a comprehensive approach. Let's explore the other key factors that influence calcium absorption in seniors. First, we need to address the vitamin D component. Even with adequate calcium and avocado intake, without sufficient vitamin D, your body simply cannot properly absorb calcium. In fact, a study from the Cleveland Clinic found that elderly patients are at particularly high risk for vitamin D deficiency due to several factors, including diminished diet, certain medications, and reduced sun exposure. Robert, a 77-year-old patient, was consuming avocados regularly but still showing poor calcium utilization. When we tested his vitamin D levels, they were severely deficient at just 15 ml. Optimal levels are 30 to 50 nanograms ml. After 3 months of vitamin D supplementation combined with his avocado routine, his calcium absorption markers improved dramatically. Here's a vitamin D action plan that works well with your avocado strategy. Spend 15 to 20 minutes in morning sunlight several times weekly, without sunscreen on, at least face and hands. Consider vitamin D3 supplementation of 1,000 - 2,000 IU daily after consulting your doctor. Include vitamin D-rich foods like fatty fish and egg yolks in your diet. The second crucial factor is reducing calcium inhibitors. Certain substances can actively block calcium absorption, negating the benefits of both calcium intake and avocado consumption. The main culprits include 1. Excessive sodium, salt. 2. caffeine in large amounts. 3. Phosphoric acid found in sodas. 4. Oxalates in some vegetables like spinach and rhubarb. 5. Phytates in unsoaked beans and grains. For Elizabeth, a 73-year-old with a 3-cup-a-day coffee habit, simply reducing her caffeine intake made a substantial difference in her calcium absorption, especially when combined with her new avocado routine. Now, I understand changing lifelong habits can be challenging. That's why I recommend starting with just one change, like adding avocado to your diet before tackling these other factors. Small, consistent improvements are far more effective than trying to overhaul everything at once. Before we move on to our next section, I'd like you to consider which of these additional factors might be affecting your calcium absorption. Could excessive caffeine, salt, or sodas be undermining your bone health efforts? Taking a moment to reflect on these potential obstacles could be your first step toward better calcium utilization. The timing connection. When to eat avocados for maximum benefit. Timing matters when it comes to nutrient absorption, particularly for seniors whose digestive processes have naturally slowed. Let's explore how to time your avocado consumption for maximum calcium absorption benefit. Research suggests that calcium absorption is most efficient when consumed in amounts of 500 milligrams or less at a time. This is because your body's absorption mechanism becomes saturated above this threshold. For seniors taking calcium supplements, this means splitting your doses and, ideally, consuming avocado around the same time. Janet, a 69-year-old patient with osteoporosis, found remarkable success when she started timing her avocado consumption to coincide with her calcium intake. Rather than taking her 1,000 milligrams calcium supplement all at once, she split it into morning and evening doses of 500 milligrams each, having a quarter of an avocado with each dose. After 8 months, her bone resorption markers had improved significantly. Here's an optimal timing strategy. Morning. 1/4 avocado with breakfast containing 300 to 500 milligrams calcium. Afternoon, evening. 1/4 avocado with dinner containing 300 to 500 milligrams calcium. Space calcium-rich foods, supplements at least 4 hours apart. Another timing consideration relates to vitamin K from avocados. This fat-soluble vitamin stays in your system longer than water-soluble vitamins, so consistency in consumption is more important than precise timing. Eating avocado regularly, even if it's every other day, establishes a steady level of vitamin K that supports ongoing calcium absorption. William, an 83-year-old who struggled with daily avocado consumption due to cost concerns, found that eating half an avocado every other day still provided significant benefits for his bone health. Speaking of challenges like cost, let's address some practical obstacles you might face with implementing an avocado-rich calcium strategy and how to overcome them. Are you thinking about how to incorporate this timing approach into your routine? What meal would be easiest for you to add avocado to consistently? Consider your existing habits as we move to our next section on overcoming common obstacles. Overcoming common obstacles to the avocado advantage. I've heard all the objections from my senior patients when I prescribe regular avocado consumption. They're too expensive. They go bad so quickly. I live alone and can't eat a whole avocado. I don't like the taste. Let's tackle these practical challenges head on. First, the cost factor. Yes, avocados can be pricier than some fruits. But consider this perspective from my patient George, a 78-year-old on a fixed income. I realized I was spending $30 monthly on calcium supplements that weren't working well, while $15 worth of avocados actually improved my bone density. It wasn't an additional expense, it was a more effective allocation of my health budget. If cost remains a concern, try these strategies. Buy avocados when on sale and learn to ripen them at home. Look for smaller varieties that cost less per fruit. Consider frozen avocado chunks, which are often more affordable and prevent waste. Split avocado purchases with a friend or neighbor. Next, the ripening and spoilage challenge. Many seniors find themselves throwing away overripe avocados, which feels wasteful. Martha, a 71-year-old living alone, solved this with a simple technique. She buys avocados at different ripeness stages, refrigerates those that are ready to eat, which slows further ripening, and uses this preservation method to extend usability. Cut ripe avocado in quarters. Lightly brush exposed flesh with lemon juice. Wrap tightly in plastic wrap, removing as much air as possible. Refrigerate for up to 3 to 4 Dalton's whisk. For those who dislike avocado's taste or texture, I recommend the stealth approach. Richard, a 76-year-old who couldn't stand avocados, discovered he could blend a quarter avocado into his morning berry smoothie without detecting the taste while still getting the calcium absorption benefits. Other stealth methods include blending avocado into chocolate pudding. The cocoa masks the flavor. Mashing avocado into hummus. Adding small amounts to soups as a thickener. Incorporating avocado into baked goods as a fat replacement. Another concern I hear is about medication interactions. While avocados are generally safe, they do contain vitamin K, which can interact with blood thinners like warfarin, Coumadin. If you're on blood thinners, this doesn't mean you can't eat avocados. It simply means you should maintain consistent consumption and inform your doctor, who can adjust your medication accordingly. Helen, a 79-year-old on warfarin, worked with her physician to maintain stable avocado consumption, and they simply adjusted her medication dosage to accommodate this beneficial food in her diet. Have any of these concerns been holding you back from incorporating avocados into your calcium strategy? Which solution seems most practical for your situation? The key is finding a personalized approach that works for your circumstances, preferences, and budget. The bigger picture: avocados in a comprehensive bone health plan. While avocados can significantly enhance calcium absorption, they work best as part of an integrated bone health strategy. Let's put all the pieces together to create a comprehensive plan that maximizes the avocado advantage. First, let's talk about movement. Weight-bearing exercise signals your body to retain calcium in your bones rather than release it. Even for seniors with mobility limitations, appropriate exercise is essential. Frank, an 87-year-old with severe arthritis, maintains surprisingly good bone density by combining his avocado-enhanced diet with seated strength exercises 3 times weekly. A simple starter routine includes standing up from a chair without using hands, 10 repetitions twice daily. Gentle walking, even indoors, 15 minutes twice daily. Light resistance exercises using bands or small weights, twice weekly. Second, consider bone-healthy hormones. For women, the dramatic drop in estrogen after menopause significantly impacts calcium absorption. For men, decreasing testosterone also affects bone density. Discuss with your doctor whether hormone optimization might be appropriate for your situation. Reclaiming your bone health. It's never too late to start. Let me tell you about Helen, who came to me at age 82 after suffering her 3rd fracture in 2 years. Her bone density was dangerously low, and she feared losing her independence. "Is it too late for me?" she asked, her voice trembling with emotion. "Have I missed my chance to have strong bones again?" I shared with Helen what I'm now sharing with you. It's never too late to improve your bone health. The human body maintains its remarkable ability to adapt and heal well into our 80s and 90s. Even small improvements in calcium absorption can significantly reduce fracture risk and preserve independence. Helen committed to our comprehensive approach, including daily avocado consumption. She diligently followed the timing strategies we discussed, combining avocado with her calcium sources and eliminating absorption inhibitors. She started gentle strength exercises and improved her vitamin D status through appropriate supplementation. 1 year later, Helen's bone density scan showed something remarkable. Her bone loss had not only stopped, but had slightly reversed in some areas. More importantly, she hasn't experienced another fracture in the 3 years since starting the program. "I feel stronger," she told me at her last visit. "I'm not afraid of falling anymore. I can play with my great-grandchildren without worrying about breaking something." This is why I'm so passionate about sharing these strategies with you. Bone health isn't just about preventing fractures. It's about maintaining your independence, your dignity, and your ability to continue doing the things that bring you joy. It's about remaining active participants in our own lives rather than becoming spectators limited by fragility. The gift of incorporating avocados into your calcium strategy is that it's such a simple change with potentially profound effects. You don't need expensive equipment, complicated routines, or radical lifestyle overhauls. You simply need to add this nutrient-dense fruit to your existing diet in thoughtful ways. I encourage you to start today, not next week or next month, because your bones aren't waiting. Every day presents an opportunity to either build them up or let them continue weakening. The choice is yours, but now you have the knowledge to make an informed decision. Always consult your doctor before making health decisions, especially if you have existing medical conditions or are on medications that might interact with avocados or other dietary changes. While the strategies I've shared work for most seniors, your specific situation may require personalized adjustments. If you found this information valuable, please don't keep it to yourself. Hit the like button so more people can discover these bone health strategies. Subscribe to our channel for more evidence-based health advice specifically designed for adults over 60. And click that notification bell to be alerted when we release new videos on nutrition, exercise, and wellness for seniors. Most importantly, share this video with someone you care about who might benefit from better bone health. Perhaps a friend who's concerned about osteoporosis, a sibling taking calcium supplements without seeing results, or a spouse who could use some motivation to improve their nutrition. In the comments below, I'd love to hear about your experience with avocados. Are they already part of your diet? Will you be incorporating them differently after watching this video? Or do you have questions about calcium absorption that I could address in future videos? Remember, good bone health isn't just about adding years to your life, it's about adding life to your years. With avocados as part of your calcium strategy, you're taking a simple but powerful step toward a stronger, more active future. I'm Dr. David Walker, and I'm committed to helping you live fully and vibrantly in every decade of life. Until next time, take good care of those precious bones of yours.